This is Dr. Mohammed. I'm an epidemiologist. I am a detective. I try to look for diseases, injuries, death in population. And as we talked about in our first part of detective epidemiology, we want to figure out what causes the disease. How does it affect your body? And what conditions that define the population. Not everybody is at risk. Some people are going to get the disease, some others. We want to know who is more vulnerable to these diseases. We want to count and count and count and count and count. We use a language called counting. What do we use counting for? For statistics and mathematics. So here, epidemiology has 7 key language. As a detective, I'm looking for the rates, I'm looking for ratio, I'm looking for incidence, I'm looking for prevalence, mortality, morbidity, and life expectancy. These are the tools we use in epidemiology as our language to communicate to everybody about where we are with disease occurrence in the population. One of the important tools is called rate. We can use the rate to compare the difference between one rate of an outbreak in one time with the rate of an outbreak in another time. We want to look at the cases, who is affected, who got sick. Rates are number of events in given population over a period of time. For example, we say natality rate, how many infants die. We talk about morbidity rate, how many people get sick. We talk about mortality or fatality, number of people who die. Morbidity or incident number of health events happen, number of cases of disease in a population. So we use morbidity rate for many diseases. We look at important is the study of acute diseases. Acute diseases that occur very quickly in a population versus chronic diseases that occurs in a population or in an individual over a long period of time. We also use the language called attack rate. Incidence rates calculated by a particular population of a single outbreak. So we want to know what was the percentage of attack at a particular time. Morbidity prevalence rate, number of new cases that we find. And it's very useful to study chronic diseases in the population. You can calculate the morbidity, mortality, as I said, by mathematics. You put the number of new health-related events or cases of disease over number of people affected, become incident rate. Attack rate, we put number of people were attacked during an epidemic over number of people exposed. Prevalence is the total number of individuals who have gotten the disease and overpopulation at risk. So we want to know from 100,000 people what was the rate of the disease within that population. Crude and adjusted death rates or adjusted rates or incidence or prevalence expressed as a crude or a specific rate. Crude rate is a denominator include total population, mean everybody in it. For example, crude birth rate means number of live births in a given year divided by the mid-year population or average population. Crude death rate, number of deaths in a given year for all cases divided by mid-year population. So it's a crude birth rate and crude death rate. Age-adjusted rate used basically to compare the risk within a different age group. So it's a car accidents occurring within people under 18 or on over 18. For example, we know almost 36% of auto accidents rate occurs among kids who are under 21 years of age. Crude rates are calculated by number of live births estimated by mid-year population times 1,000. Or crude death rate, we can do it by 100,000. The specific rates in epidemiology, we measure morbidity and mortality by using crude specific mortality rate measures, rate by specific case, and case fatality rate or percentage of cases of a particular disease that results in death. Now we want to know what proportion of population has mortality. We call percentage of overall mortality that is attributed to a particular case. So we could particularly find out the proportional mortality or proportion of population actually died because of a particular disease. And these are the way we could calculate them, number of, as I went over them, age-specific death rate from below all the way to the top, case-specific death rates. So every time as a statistician, as a person, as a detective, you're trying to find out, hey, I want to know how many people are affected by this particular problem or disease. I want to be able to communicate. We use crude birth rate, crude birth rate, crude death rate, age-specific death rate, infant mortality rate, we call it IMR. We use these to measure the health. IMR is used extensively in international health. The number of kids who die out of 1,000, which is in the United States on the track, is the middle one is 6.5, means 6 children die out of 100,000. So therefore, we want to reduce that rate. We know in a different population, that rate is much higher. We also have to report these statistics, these numbers to the population to educate them, to make sure they take proper measures to deal with that. We have physicians, clinicians, hospitals are all required to report diseases. In particular, we have two forms of diseases, notifiable diseases and non-notifiable diseases. Non-notifiable diseases are something that happen within the population very seldom, but notifiable diseases are infectious diseases, HIV/AIDS, syphilis, thyroid, typhoid, and others are notifiable diseases. These are reported to CDCs via electronic telecommunication system called NETs. And it's automatically collected, and obviously the whole idea is to be able to maintain this data and develop a good record and be able to accurately identify the more vulnerable population. That's much more important right now because of many of the diseases spreading population. Immunization record is one of the ways we keep record of number of immunization children have had in order to understand the rates of vulnerability in the population. Notifiable disease, the track, hospitals, clinics, doctors report them to local department. Local public health department hire epidemiologists, and they're the one who generate reports. I receive these reports from the local public health department on a bi-monthly basis. State of California collects that data, create an annual report, and many of that stuff goes directly to Center for Disease Control. If particular disease outbreak occurs in a particular hospital or so, immediately it's reported through the system to the CDC, and they do bring laboratories and experts to try to investigate to make sure they stop the outbreak quickly. Population health stats. Mortality statistics. Most reliable measure of population health status. Life expectancy is the average number of each person from a specific cohort is projectedly from. These two are very much used for status of population. For example, we know life expectancy among male and women have increased dramatically, particularly to the technology and the social environmental availability of healthcare services. And we also look at mortality to see, for example, individuals who die from a specific disease, from cancer mortality rate, so we understand how we can prevent prostate cancer, breast cancer in the future. Life expectancy is very much in use. This is very, very important because, for example, insurance companies use this to sell insurance. They use these actuarities to try to project how long you're going to live. So life expectancy, as you know, has increased dramatically for both sexes, and it's gone from 1900 to be 47 years to now 78 years for both genders. Female lives longer, about 81 years, and 1 year, and male for 76 years. You can see that life expectancy has increased, and we will talk about what are some of the contributing factors to increase in life expectancy in the population. Here our potential life loss, we want to know, for example, this is also used in insurance. We want to know if you receive a disability as a result of an accident, how much potential life you're going to lose. And they give some value to that. And we use that obviously to use it to justify that if a person dies at a young age, so many years going to be lost. So we call this YPLL, years of potential life lost. Other measures are called disability adjusted life years. And that means, how many years you can adjust and measure the burden of disease on you throughout your life. One lost year of healthy life is used. Health adjusted life expectancy, number of years a healthy life expected on average in a given population or a region in the world. We see that here is much higher in certain part of the world because of consumption of food, a better diet or environment than other parts of the world. This concludes our part 3. Have a great day and always remain a very good detective. Bye.